Hi, I'm Dr. David Hill, and today we're going to talk about how to treat heartburn in children. Now, when we say heartburn, we're usually talking about a sensation in the chest, what we would call a substernal discomfort. This bone right here is the sternum. It's under that bone, therefore substernal. Usually it is sort of a burning or fullness feeling, and when we hear that complaint, we usually think that stomach acid and stomach contents are coming up into the esophagus, causing discomfort. That's part of gastroesophageal reflux disease, or GERD. What do we want to do about that? Well, the medicines that we use are all focused on reducing the levels of stomach acid in the stomach and in the esophagus. And we feel that if we can get that acid out of the way for a couple of months, usually that part of the stomach and esophagus will heal up enough for the symptoms to go away and not recur for a long time. There are two classes of medicine. One is actually a different kind of an antihistamine. It doesn't do a lot for a runny nose, but it does reduce stomach acid secretion. These are medicines like Zantac, Pepcid, or Axid, ranitidine, nizatidine, and the other one. But at any rate, they're antacids that work as antihistamines. They're an older class of medications, and they're somewhat less powerful than the newer class of medications that we call proton pump inhibitors. Now, the proton pump inhibitors, the best known is prilosaccharoomeprazole. That one's over the counter and relatively inexpensive. There are also some branded proton pump inhibitors. There are quite a few of them now. The easiest one to give to a young child is probably lansoprazole or Prevacid, because it comes as a dissolving tablet. The others just come as pills or capsules. There is now a form of omeprazole that is liquid with sodium bicarbonate in it, but it does have to be prescribed by your doctor. That form is not over the counter. The idea would be to use this proton pump inhibitor once or even twice a day for a total of about 60 days. Now, if you're not getting relatively rapid relief, if the child is vomiting blood or having blood or black tarry stools or coffee grounds and vomit, those are all really good reasons to go see the child's doctor. Also, if the pain is unusually severe or seems atypical from prior complaints that the child has had. Now, there are some lifestyle changes that you can make as well. If the child has caffeine in his or her diet, likes to drink soda or tea, for example, you really want to eliminate caffeine, even the caffeine in chocolate. If anybody in the child's household smokes cigarettes, you really want to eliminate that, or at least get it as far from the child's environment as possible. Even secondhand tobacco smoke can worsen reflux and reflux symptoms. So, talking about what to do for children with heartburn or gastroesophageal reflux disease, I'm Dr. David Hill.